We started CIDN Lab because we wanted a lab by dentists for dentists.
The focus of the Canadian Implant Dentistry Network Digital Lab is to deliver things such as dental implant crowns, fixed prostheses, temporaries, overseen by us as dentists directly to dentists.
We have a 3D printer, and we have a mill that can mill all sorts of materials: zirconia, titanium, porcelain. So we'll mill custom abutments, custom profiles for our implants. We'll mill crowns that go on top of that, crowns that go on teeth, bridges, full arch implant bridges, everything you can think of for dental restorations we can do on our mill. After it comes out of the mill, it has to be stained and glazed and made the perfect color for the patient. So it goes in the oven there to bake into the right finished product. We can print models, which help us diagnose and help us plan things. We can print night guards, which will help protect all the work that we've done in the patient's mouth.
Not only do we provide the crowns and bridges that return back to the doctors, but we also provide mentorship and the actual surgical placement of the implants themselves.
We create a guide, a pathway for the doctors to drill to place the implants exactly where they should go, so there's the best end result prosthetically. The final prosthetic design will lead into how long the prosthetic will last for, how maintainable it is, how hygienic it is, and how wrong things can go if things aren't designed properly. And by building this laboratory on site alongside our great doctors, we were able to open up a direct line of communication between what our expectations are, why we design things the way they should be, and then they're trained to design that for other doctors based on what doctors know it should be.